Greetings to all. My name is Dr. Vinay Gaikwad. I'm the Director of Surgical Oncology at CK Birla Hospital in Gurgaon. I want to talk to you in this video about how we can detect cancers early. This is very, very important because cancer is on the rise. More and more people are being diagnosed with cancer, partially because of increased awareness, but also because of many reasons which are environmental, which are familial, and so on. So it's important for us to understand how we can detect these symptoms of cancer very early so that either we can detect it before the cancer actually develops or we can detect it in time to ensure a cure. Because contrary to popular belief, cancer is curable if detected early, and that's a very important clause, to detect it early. Most patients who present to us as oncologists present at a later stage because they've ignored the early symptoms, and by the time they seek medical attention, the cancer is already in the later stages or sometimes even in the last stages, and we are not able to do much. But those patients or those individuals who come to us in the early stages, more often than not, can achieve a cure and a normal life with the appropriate treatment. So now what are these symptoms that we have to look for? Yes, I agree, sometimes we do not have symptoms that are blaring, that come to us in our face, that we can actually think that there's something seriously wrong with us. And we should not be paranoid that every symptom we face is because of cancer. But there has to be a balance that we maintain. So we have to be aware of what could be the possible symptoms. Something common to most cancers in our body is something called unexplained weight loss, which means we're not actually trying to lose weight, but in the course of time, let's say a couple of months or more than that, we've lost a very significant amount of weight without intending to. That could be one of the symptoms of cancer. There could be other diseases as well, but this is something that has to be kept in mind. The other thing is a loss of appetite, not feeling hungry all of a sudden, especially in someone who usually had a good appetite in the past. Other symptoms to be kept in mind is bleeding from any orifice we have in our body. Bleeding means puking or vomiting blood, bleeding through the mouth, through the nose, blood in stool, blood in urine, blood in cough. These are all telltale signs that could be leading to cancer. Especially bleeding in the stool has many other reasons such as hemorrhoids, fissures, and so on. But if it's painless and it's persistent, it should be checked up and it could be a possible sign of cancer. Now coming to a common cancer called lung cancer, persistent cough, maybe a change of voice, all these things could be leading us a symptom of lung cancer. Coming to abdominal cancers, there could be a pain in the abdomen, there could be jaundice. As mentioned before, there could be blood in the stool. All these symptoms patched up together is something that we need to consider and maybe get a consultation. Lumps anywhere in the body, any newly developed lump, maybe in the breast, maybe in some other part of the body, should be looked at seriously, especially if it is increasing in size and it's painless. I hope this information has been useful. We should keep in mind all these symptoms and these signs that can help us detect cancer early. Because we cannot prevent cancer, because we can lower our risk, and more importantly, we can detect these signs and symptoms early so that we can attain a cure. Because remember, cancer is curable if detected early.
If you found this video helpful, don't forget to give it a thumbs up and share it with your friends and leave your thoughts in the comments below. And of course, subscribe for more content on health and lifestyle.